How are you mommies to be? If you're around 16 weeks pregnant, you probably have a lot of questions, like, what does my baby look like now? Can you tell the gender yet? And what kind of testing does my doctor offer? Well, in this video, I'm going to talk about how your baby is developing, how you might be feeling, some common symptoms you could be experiencing, and what to expect at your next OB appointment, including genetic testing. Basically, everything you need to know about your pregnancy right now, we're going to cover it all. But first, if you're new here, you're watching in the Health and Medical Zone. And if you're wondering what that means, in the Health and Medical Zone stands for being in good health and spirit. So if you like being healthy and happy, make sure to click subscribe because you're definitely in the right place. At 16 weeks of pregnancy, you are officially 4 months along with about 24 more weeks to go. Your baby is around 4 inches long and weighs about 4 to 5 ounces, roughly the size of an avocado. Even though your baby's eyes are still sealed shut, they're starting to perceive light and can even move side to side. Their tiny heart is beating fast, about 150 to 180 beats per minute, and it's pumping around 24 liters of blood every single day. On ultrasound, your baby is starting to look more like, well, a baby. Their legs are now longer than their arms, giving them a more proportionate look. The taste buds are beginning to function too, which means your baby can actually taste the amniotic fluid. And fun fact, the amniotic fluid can take on the flavor of whatever you're eating. So your little one might already be developing their taste preferences. Your baby's head is starting to become more erect now. It's no longer bent over like it was in the first trimester. It's more in line with the rest of the spine, like this. As for you, this is usually the time when most women feel their very best. By now, morning sickness is fading away. And because you're feeling better, you can finally enjoy food again. You might even start to have a few cravings. Another great thing about the second trimester is that your energy is back. You're not as exhausted anymore, and your belly isn't quite big enough yet to get in your way. That makes this the perfect time to start getting ready for your baby's arrival. You'll want to make sure you have a bassinet or crib, and you'll need a car seat before you bring your baby home. At your next OB appointment, your doctor will probably talk about second trimester screening. This is a blood test that checks whether your baby has a higher chance of having a genetic disorder. Things like Down syndrome, a neural tube defect, or trisomy 18. These tests don't mean your baby has one of these conditions. They simply show if there's a higher chance. If the results come back abnormal, your doctor might refer you for a test called amniocentesis. During amniocentesis, a long needle is inserted through your abdomen into the uterus to collect a small sample of amniotic fluid. There is a slight risk of miscarriage with this test, about 1 miscarriage for every 200 tests performed. Now, it's important to know that these genetic conditions can't be cured or treated while the baby is in the womb. So finding out about an abnormality doesn't necessarily mean there's something you can do about it. Because of that, many women choose not to do any genetic testing at all, and that's completely okay. There's no right or wrong choice here. It's entirely up to you and what you're most comfortable with. It's also pretty common for OBs to do an ultrasound around 16 weeks. This one is really exciting because if your baby's legs aren't crossed and the umbilical cord isn't in the way, you might be able to find out the gender. It's not always the clearest view. The big 20-week ultrasound is usually the best for that. But if your baby cooperates, you can definitely get a good peek. When your OB or ultrasonographer looks for the gender on ultrasound, they'll focus on a cross-section of your baby at the level of the hips. On the screen, you'll see the thighs, and right between them, that's where the gender can be seen. You might also notice your OB taking some measurements during the ultrasound. If they do, they're measuring certain parts of your baby, like the head, abdomen, and the length of the femur. These measurements help estimate your baby's size and weight, and make sure they're growing right on track. In next week's video, I'll be talking about sleeping positions, and also when it's safe to have sex, plus a few situations when you shouldn't be having sex. So, hit that bell notification so you don't miss it. And if you haven't already, check out some of my earlier pregnancy videos. They're packed with tons of helpful information. Click on that and I'll see you over there. Before we wrap up, you might also notice your gums feeling tender or even bleeding a little. That's actually due to increased levels of the pregnancy hormone progesterone, which makes your gums more sensitive to plaque bacteria. Thank you so much for watching.